Welcome to tonight's In Focus on Whitewater Community Television's WCTV Channel 11. Everything continues to change. Where we are, where we have conversations, how we do this, how we live our lives, continuing to change. Right now, we normally get to do this in the studio.
Right.
We normally go for 90 minutes. We're not in the studio, and we don't have 90 minutes.
Right.
So we'll unpack a little bit less.
Sure.
I'm having a chance to talk with Richmond Mayor Dave Snow. I have to do my disclaimer. Dave Snow is a member of the Whitewater Community Television Board of Directors. Whenever I talk to someone who's a member of the board, I do like to kind of flesh
Sure.
that out, so when I'm throwing softballs, people know I'm just working on my job, man.
Sure.
Listen, I know a lot of people expect me to start with COVID-19 probably, and we will get to that, but there
Okay.
are other parts of government that are still going on, things that are still happening
Absolutely.
that I kind of want to talk about first.
Yeah.
So let's roll out a couple of things. First of all, and we're seeing a lot of public service announcements about them, and they really will affect this community. The 2020 census, do
Right.
you have words for the community? They're at home right now, probably, hopefully close to something that can get them online. They should probably handle that.
You have your census packet in the mail, and we put together a really robust county-wide census marketing plan. And we worked with some county partners. We worked with the Wayne County Foundation and Wayne County government to partner together to have a big county-wide marketing plan for radio ads, Great Deals Magazine, billboards, PAL item print, everywhere talking about the census. It's really, really important that we get a complete count. You probably have your packet in the mail, and hopefully you have the digital access to complete that. I know that some of their plans are a little up in the air as far as sending people out to do the data collection.
Right.
But if it gets to that point and you still haven't participated, when things calm down and they do that, we just hope you find your way to participate, because a complete count is so important to so many organizations across this community, and we see the importance of that. So does the foundation, so does the county government, so we're all putting a big push behind this.
Talk a little bit about why that count really does affect this community, Wayne County as a whole, Richmond in particular.
Right. Well, you could go on, and you're going to hear all the radio ads and the marketing, but if we just boil it down to its most basic conversation, a lot of that is going to be condensed into conversations about funding. And so without the complete count and without knowing who's being served and how they're being served and where, then funding can be reallocated and shifted and moved. Districts can be shifted. So it's important. We need to know where you are and the things in which you participate and who's in your household, so that you can be better served. And it's really important to this community as a whole. And I firmly believe that we could be shifting towards a stabilization in our population. But without a complete count, we won't know that. So it's just another important reason that we get a complete count out of this.
Well, since we're talking about people at home, people online, being able to fill out things, the park master plan, is that still going on? Is that site still open, and can people still go in and provide their information about what they would like to see and expect from their parks?
Sure. We just completed the initial phase of data collection on that. So there have been the paper surveys, online surveys, open houses, and our response has been unbelievable. We saw upwards of 2,000, almost 2,000 responses in that data collection phase. So now that data is being compiled, we're still going to have more questions and interaction with the community about that. But first we have to kind of boil down the data and take some of the highlights and the major talking points, and then reintroduce that and say, here's some of the things you identified. What do you want to cherry pick out of this? And so more discussions to be had. But right now that initial data collection phase has concluded, and they are now compiling that data. So stay tuned. More updates will be coming on that front. But this is a good time for me to thank everyone that participated and gave their input in that process. That is invaluable data to us to compile and then move forward in how we want to continue with our Parks Department.
I went on and I did, and I was surprised at the number of questions as it kept going on, and how detailed you all were getting as to where you are, what parks you were using, what particular things that you really wanted to see and do.
It's time for those discussions. You know, I've poured through documents that are 40 years old about where our parks were 40 years ago and some of the conversations that were happening. And some of those conversations have just carried through the years. So it's really time we have some big discussions about what our parks look like in the next 10 years. And I guess to really get into some specifics on that and not talk in such general terms, I'm really passionate about Glenn Miller being more walkable and joggable and a little more people friendly, because right now you go into Glen Miller, and if you've lived here your whole life you don't think about it, but there aren't really sidewalks around. It's roads. It's a little more car friendly than it is people friendly.
Yes.
But it was built as a driving park, and it still today sort of sits as a driving park. So is it time to bring about a shift in Glen Miller to make it a little more people friendly? And that's what we want to hear from people in those conversations, and help us make those decisions informed by you. And people did that, so thank you for participating.
I remember probably, I don't know, 2.5 years ago, you and I were talking, and you thought you were going to get in trouble for people because you asked them not to drive through Glen Miller as much, not to take some of those shortcuts, because people are using those as walking paths and make it safer.
And people have been doing that. I've gotten a huge response from people that said, ever since then, I drive through there much less. And I've gotten responses from people saying, when I'm in the park, there is less traffic, but I will still bump into the occasional person. I just talked to a gentleman, gosh, maybe it was about a month ago, before all of this started happening. But he said, I'm new to the community, and I go out and I do a lot of walking and running, but I'm trying to run through Glen Miller. It's beautiful, and then these cars come flying past me. It's very strange. So he thought that was just a little weird, and I said, well, it's kind of how it goes here. But we're collecting the data to see if some of those changes need to come about now.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're spending some time with Richmond Mayor Dave Snow. It's spring. It doesn't always feel like it. The changes are going on. I'm starting to see things green up in my yard. My grass isn't as green as my neighbors, but you know, they get their stuff sprayed with things. Talk about, even though we are quarantining ourselves a little bit, social distancing ourselves a little bit, people will still need to get out. They'll want to walk through the parks. They'll want to do that kind of thing. And they'll want to clean up their yards. Talk about how our social distancing might affect what our spring cleanup looks like. And are there things that the sanitation department is still going to have in place where if people do that cleaning, they get the branches, a place that those can be dumped?
So lots to talk about in the realm of citywide cleanup. We were shifting towards, and we still are, a brand new way to do our citywide cleanup. There's some confusion that comes from our previous model that we've been working to clean up through our code enforcement department. In that former model, which was that amnesty model of during this 6-week period, throw all your garbage in the alley and we'll come by and get it, creates a lot of confusion in the community. And it opens this window of, well, I can do it now, but I can't do it next month. And it's created some bad habits. And so we built a new code enforcement department. That department is fully staffed and running and doing a great job. And so we don't want to bring that confusion back to the community of saying, here we are issuing fines and working with the community members to learn how to better do this. We do have special pickups available that you can call for anytime for large items that you can't get to the landfill and yard waste that you bundle up. Those things are in place all the time, all year round. And so we create this confusion saying, but during this 6-week period, it's the Wild West. Throw everything out, we'll just come get it. It's really confusing, and it kind of takes us backwards in the education that code enforcement has done with this community in their partnership, and they've done such a great job. So what we're talking about is a new model, not going back to that old model of it's a 6-week, 8-week amnesty, free-for-all, Wild West, no fines, no fees, everybody just throw your stuff out and it's going to be okay. That's the past. And there's no reason to go back to that. So we're going to shift into a new model where we're going to use our large roll-away dumpsters and bring those strategically on a calendar through areas of the city and say this is when they're going to be there, and then you can bring your waste to that if you have things that you can't get all the way to the landfill. And so we started working through all that, and then we kind of hit this recent situation which brought about displacing some people and disrupting our process. We're going to get back to that. We will have the citywide cleanup this year. Okay. I'm hesitant to set the concrete date for that because of the fluid environment we're in.
Sure.
But we'll have more information to share on that. But I do think it's important to let everybody know as soon as possible that that old model is going away. We are in a time now when we have a very effective code enforcement department who wants to be this community's partner and teach the importance of not throwing TVs and tires and brush and furniture and mattresses in alleys. Those days are gone. And we're not going to, and if you recall when we launched the code enforcement department, we said this is the last opportunity for amnesty as we train the city that these are the new rules, and we've been through that. So those amnesty periods are over. So now we're going to transition into being the partners that we want to be and saying, we're going to bring these tools to your neighborhood, but you're still going to be responsible for getting the trash either to the dumpster, calling for a special pickup, or taking it to the landfill yourself, or properly disposing of it in your Rosie roller. So those are the models that we're shifting towards now.
Okay. We kind of keep dancing around the idea of COVID-19 and how it has changed what's going on. So let's go ahead and take the deep dive.
Okay.
And talk about everything that's going on. This is normally we have a live conversation in studio and we're taking people's questions. We're recording this on, I don't even know what day this is, Monday of this
Right.
week, for airing on Thursday. The governor spoke earlier today. Personally, from what I've heard, and I haven't had a chance to sit down and go through everything, I think the direction that the city of Richmond and Wayne County went last week when you asked businesses to lower their employee levels by 30% is maybe even a little bit farther than where the governor went today. How did you see what he laid out, and what has it changed as far as what you think the city of Richmond needs to do?
Sure. So there's quite a bit to talk about here. So right now we have an epidemic task force in place, and that task force is comprised of leadership from the health department, Reed Health, county government, Wayne EMA, city government, our first responders all have representation in these task force meetings. One of the early tools that we gave to our healthcare professionals was to say, if you start to see the spike, then let us know, so that we can implement the tools that we have to try and reduce the spread of illness. Because as everyone knows now, it's become common conversation, we are trying to flatten the curve. If we do not take those steps as a community, and we see a surge that the healthcare providers can't handle, then people can't be treated, and we run out of equipment. That leads to more sickness and possibly more tragic outcomes, which we don't want to see. We don't want to see that here at home in our community. So our first step was issuing the level 2 travel advisory, just to send out that very first warning to pare this down to essential travel only. As we navigated through this, and Ken said it Friday at our press conference, he said he got a call, or that he and I both got a text from our healthcare professionals that said it may be time for heavier restrictions, and they referred to the level 3 travel advisory. That put us right in here in meetings almost immediately. Is the level 3 travel advisory the right step to take? And since then, we've had many people call and email us saying both sides. Yes, I would like to see that restriction put in place, and others saying don't go to that level. It's too restrictive. Here's the issue, though, and I'm gonna be really transparent in unpacking this for everybody. As we sat down to discuss that, what we learned quickly is that level 3 travel advisory is in place to speak directly to inclement weather. It says directly in there, you must be off the roads so that the street crews can clean them. They're full of snow and ice, and so travel is dangerous. Well, we have a situation here where travel in and of itself is not a danger. It's your destination and your proximity to others when you reach that destination. That's our issue. So utilizing a level 3 travel advisory is using a wrench when you need a hammer. It's not the right tool out of the toolkit to use. So that put us in about 8 hours of meetings trying to write the language necessary. There really aren't statutes and ordinances that deal with this, that deal with proximity and reduction of workforce and shelter in place. These things don't currently exist in that framework because this is brand new territory for all of us. And I guess coming to the end of that, because we can talk a little more about the restrictions that are in place, but I've had many people say to me, will you start issuing fines? Or what are the fines? What if people are out and about? What if places don't close? Are there going to be fines? And my response to them, albeit possibly overly blunt, is the fine is human life. Stop waiting for a ticket from the police. I don't know why a $200 ticket is what motivates you to take this seriously. Human life should do that. And if we spread this, people will die. That's enough, right? Isn't that enough? And I don't mean to be that blunt or that callous about it, but that is what is at stake here. I don't know why so many of these people are waiting for enforcement. Well, I'll wait until they make me, or I'll wait until we get a ticket. That shouldn't be what you're waiting for. Spreading this to people that are in high-risk categories, particularly as healthcare providers start to run out of equipment and ability to treat, means these people will die a very tragic death. We've seen what this does to people. It's very ugly. Why you would put people in that situation because you're waiting to get a $200 ticket or a $50 fine, I don't know. So it would just be best if you hear the restrictions that are in place and know that national government, state government, county government, city governments are all working together to take this very seriously. You as a citizen, as an employer, have a responsibility to take this very serious because human lives are at stake. I think that's the message.
And I think the message is getting out there. There's been mixed messages from a number of different places. And I think people don't know what to believe. And government is not all speaking with one voice, whether it's from the federal, the state, the city and county do seem to be.
Right.
But it's almost like the question that I asked, Reed is a regional hospital. Are Wayne County, Franklin County, Fayette County, the counties that feed in, all working together also to speak with one voice? And I think that's what people want to know, that one particular area is not being put upon more than another.
Sure. And that's a great question. And I think when you asked that question in the room on Friday at the press conference, it really wasn't met with a direct answer, because I think the same thought was going through everyone's head is, well, who in this room has jurisdiction in an adjacent county? And no one has that jurisdiction.
Right.
Reed
is having the conversation with you all. Are they having those same conversations? And are the commissioners and mayors of those communities, can you all see, because you all are in contact with each other, can you all see them putting the kind of restrictions in place on their citizens that you all are putting on the citizens of Richmond and Wayne County?
Can I foresee them doing that, or am I seeing them do that?
Are you hearing those restrictions going into place?
I have not heard that, nor have I seen that. We have been monitoring some of the adjacent counties and haven't seen much. What I can tell you is we've been trying to work here as a central point of contact and communication so that we can all be using the same talking points and the same information. Because I have to commend everybody in that task force, and I have to commend the public. I got to make sure that I say that. We have so many people in our community that are taking this seriously. They are doing their part. We've seen a huge amount of cooperation. Do we have those who are resisting that cooperation? Absolutely. And I hope that they see the importance of cooperating with the directives and the orders that have been put in place. And I have to highly commend everybody here on our Richmond City team, everybody at the county government, everybody at the health department. Everybody's been working so well. The media, you've been doing a tremendous job. So there's been a huge team effort here. And so we're trying to work as that central point of communication and contact so everybody has the same talking points and information. So we're going to start now. What I just asked the task force today in our meeting was, can people start getting me contacts in adjacent counties so that as we compile this information, we can at least share it with them so they have it and they know what guidelines and directives under which we are working. So as people navigate into Wayne County for work, they at least know how we're operating. But not having any jurisdiction there, we can't really order them or direct them to do anything. They have to take it upon themselves to take up those initiatives. But I'm very proud that we as a team have all worked together to put us ahead of the curve. Here in Wayne County, we're taking steps. I've received texts from people that have lived here and now maybe live or work elsewhere, and they've said, I'm so happy that back home, you guys are on top of this, because where I'm living, it's not being taken as serious. So I'm proud of all of us for the work we're doing, and we're going to keep doing that. Article 5 in that executive order was that more restrictions may be coming. Right. And so we left that open-ended for a reason, because if the healthcare system continues to see these spikes and we continue to see people that aren't abiding by these directives, we'll continue to take the steps we have to take to ensure that people really are taking this seriously. But my hope is that they're hearing it enough that they're starting to get it. That's my hope.
Talk about how the directives you all have put into place are affecting what's happening in this building. I think people want to know that the city is walking the walk, not just...
Sure.
So talk about that.
So both sides of this are very, very important to me. One, showing that we are following the restrictions that are in place and we're not considering ourselves immune to that. And second, letting this community know that government is in place and working and is intact. So we have taken great efforts starting last week. We started this on maybe Monday or Tuesday of last week, phasing getting people out of our buildings and working from home. And we've done that with a huge portion of our workforce is now working from home. I want city department heads to stay in place. So they're in place out in their offices and here, and then they're working with just 1 or 2 people and then managing everybody else as they work from home. They still have a daily workload. They're still doing their job. They're just doing it remotely. So in this building now, we have much fewer people, which you may have noticed when you came in, but the department heads are in place, and I'm here. Our first responders are in place, and so that's really important for people to know. We're having a council meeting tonight via a digital platform, which has never been done before. So all of us are working together to keep government moving. We're here for this community, but we are walking that walk, and we have greatly reduced our usual in-place workforce. Those were the key words in that executive order. Your usual in-place workforce, give them the accommodations to work remotely to allow proximity. That's what's important. And I think we're even below 30% at this point. We've done quite a bit. So we're going to continue that. And if we can identify more people that can work from home as we go, we'll even continue down that path.
As you got through this past weekend, because you all had your press conference Friday night, obviously you probably got out a little bit this weekend looking around. Did it seem to you like there were less people out? Were you seeing what you needed to see? And is it what you see, or is it purely what the health professionals tell you? And is it coming from Reed Health? Is it coming from the public health department? Kind of who's driving the bus? Talk about that. I
tried really hard to stay in place all weekend and rely on the chiefs of our first responders to tell me who was out in the community, because I thought, I shouldn't be out and setting a bad example. So my entire weekend from Saturday to Sunday consisted of one 10-minute trip to CVS. And I can't tell you the last time I have just been in my living room for that amount of time.
Yeah.
It was difficult. It was difficult. My entire adult career has been just out in this community all the time. And so just being locked in my living room was it was sheer torture. But that's okay. I'm not going to cry about that, because people are struggling through many other issues with this, and mine aren't even a blip on the radar. So that's fine. So that was my whole weekend, was one 10-minute trip to CVS. And so asking if the community's cooperating, I'm getting both. We have people who are going out of their way to cooperate. Businesses, large and small, that are going out of their way to cooperate and make accommodations. And then others that I'm getting in the form of complaints saying this place or these people are doing this or that. It's a mixed bag right now. Hopefully more people will just cooperate and take this seriously. So the information comes from what's out there in the community and from the healthcare professionals, like you asked. The really important thing here to understand, we're all so used and accustomed to dealing with these kind of restrictions in just bad weather. We have ugly winters in Indiana sometimes. It snows really hard, we get some ice, things get really bad, and then as a couple, 3 days pass, things get better. That's what we're very used to. Right. So we've all been through this now 3 or 4 days of this chaos and this warnings and issuing restrictive orders. And as 3 or 4 days pass, people start thinking, well, this must be getting better, because we're a few days in.
Snow's melting.
Right, the snow is melting. But the fact of the matter is the virus is still spreading. And so we're not yet cresting that mountain and moving to the other side. The Surgeon General said this morning that this is going to be a bad week. It is still spreading. It is still an issue. It hasn't abated yet. So keeping proximity is what will keep the spread from happening rapidly, which will spike the healthcare system and make it hard to treat people. And that's where you see some of those horror stories in the news from other countries that have seen many deaths in a 24-hour period. It's a difficult conversation to have with the public, because the very last thing I want to do is incite panic. Being preventive is much more effective than panicking and just thinking a little bit ahead. We're never going to restrict your access to food. You have to be able to go to the grocery. You have to be able to go get takeout food. You have to be able to get gas and go get your medicine if you have medical needs at the pharmacy. If you have a pre-approved medical visit, you need to be able to go to the doctor. You may work for an essential service that stays operational during this. You have to be able to go to work. And one of the important things you mentioned was going out and getting fresh air. As long as you're not violating proximity, going out and taking a walk is recommended. Being healthy, going for a jog. It's being in close proximity to others that increases the spread, or touching flat surfaces and then not washing your hands and touching your face. These are the issues. That is really, really hard to police. And so people keep asking, how will you enforce? How will you enforce? It's a personal policing. It's a personal responsibility. And it's something that we're just not accustomed to. And so we have to start learning to adapt to this. And here is, I think in this entire discussion, the hardest pill to swallow. This surge that we're seeing now, and we're trying to mitigate the spike of this surge, right, may not be the only surge. Our healthcare professionals say there could be a second surge. So we may get through this where we don't see the big spike at the hospital and see people that are ill that can't be treated, and we all pat ourselves on the back and say, good job. But then we have to be ready to go back to this model at the drop of a hat if another one starts to spike. And this just brings about a change in the way that we live. And that's difficult to understand. We want to believe that once this is over, it's gone for good, and that just may not be the case. So keeping these methods in the back of your mind and being prepared to implement them again quickly is also going to be helpful in stopping the possibility of a second surge, if that comes down the road, which it could. It's happened in other countries, and it could very well happen here. So that's another difficult piece of this. This is altering our way of life, and it's causing us to adapt, and that's what we're going to have to do. But in closing on that, Hoosiers are the most resilient people on earth. We live through 104-degree summers and minus 23 winters. We're the hardest working people in the country. I'll stand by that every day of the week. So we'll figure this out. We're smart, hardworking people. We'll figure it out, and we'll get through it. It's just going to take some time and cooperation and community effort, but we'll get through it.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're spending a few minutes with Richmond Mayor Dave Snow. We're going to continue this, and again, another question that was kind of asked. Our first responders, particularly our fire and ambulance, live 24 hours together in various houses around. What is the plan if one of our first responders actually presents with symptoms of this, because he or she has probably been in close proximity with a number of other first responders? What is the plan? How is that handled? How do they get separated? And how does the fire department then kind of reassess where people are?
Sure. Well, and I've had an opportunity in this discussion to thank cooperative citizens and businesses and thank county government, city government. But this is a great opportunity to thank the first responders and our medical professionals and those people working in healthcare, just the heroes that they have been. And they know that they're at the front lines and they're at the highest level of exposure. As we do our part to shelter in place and isolate and keep proximity, it's the opposite for them. They're right there at the front lines taking that ultimate risk. And so how do you put into words the appreciation you have for the work they're all doing right now? So as we talk about the safety of our police, fire, EMS, we have PPE equipment that's been purchased. PPE is short for personal protective equipment, and that includes the masks, gowns, goggles, gloves. Those supplies are limited. They're not unlimited supplies. The eyeglasses right now, everybody's been instructed to not lose those, try not to break those, keep those clean with alcohol swabs. Right now the masks that you put on, those are unlimited supplies, so they're trying to use those judiciously. Gowns are getting to a critical level already, so the fire department has installed commercial grade washing machines so they can wash their clothing really regularly as they're out and about and back. And then talking about their exposure. So I'm going to start with the fire department, fire and EMS. If one of our workers is exposed, and you're going to have two different kinds of exposure. One could be that they know that they're going to transport someone that has tested positive and needs a transport. Another issue could be someone that just presents with any kind of illness. Then they do a transport, then they get a call later that day or the next day that that person you transported tested positive. That brings about a whole nother category of circumstances, because then they were unaware that they could have brought that back. So they're trying to be proactive as much as they can and assume that this spread is everywhere. So if they come in direct contact and need quarantine, we've put accommodations in place for that. They can quarantine at home if they wish. If they don't want to take the risk of exposing their family, we have set up a quarantine center for them, for all of our first responders, fire, EMS, and police, that we'll utilize for them if they say, I believe I've come in contact, I may need to be tested or quarantined. If testing is limited, they will have a quarantine quarters to go to if they wish. Or they can go home for that if that's what they prefer. If they've come into direct contact and we find out after the fact that all of the steps weren't put into place, we've already started a procedure where we can shift our workers into a different firehouse and then sanitize fully that particular firehouse, all the vehicles, all the equipment, and then shift them back in after we've identified who may need to go into individual or quarantining at the identified location. So we have all of those in place. And then for the police department, it's the same up to the point of evacuating the building. We don't have a separate building for the police department, but if we feel we need to section off spaces, we have a contract with local professionals who are doing sanitizing work for us, and they'll run that sanitization through the department. So, and we're doing that throughout the building. We're doing weekly cleaning and sanitization throughout the entire building. So those protective measures are in place. They have the equipment, we have the procedures to follow, and they know the risks that they are taking, and just can't thank them enough for being on the front lines of this and the work they're doing.
We're going to wrap up with, like I said, this is Monday night. We know that there's a council meeting at
Yes, there
6.
is.
And before we do that, though, I want to give you a chance to make whatever statement you need to make or want to make to the citizens of Richmond that may be watching this online or wherever. What do you want to say?
Sure. Thanks to our community. There's been so much cooperation and so many calls and emails about those who care so much about the health and safety of their neighbors and the people of this community. So thank you for your cooperation. Please take this seriously. Please heed these restrictions. A huge thanks to our first responders, our medical professionals, our other elected officials. Everybody's worked so hard to try and reduce the spread of illness in this community so that we don't overwhelm our hospital system. So let's keep that work going. I have complete faith in us. I know we'll get through this. There is light at the end of this tunnel, and I have tremendous hope that we will see a better summer ahead where we've mitigated this spread and we're on our way to some form of normalcy that we all crave so much.
I know that you've spent a lot of days in meetings. I appreciate you taking some time
Thank you.
and talking with us, and we'll be back in touch.
I can't wait. Thank you.
Wash your hands and wash them properly. That means a wetting of the hands, applying soap to them, washing them vigorously. You wash in between your hands, and you need to get friction. Friction is actually what is breaking up all of that stuff and getting them off your hands for a good 20 seconds. And if you time 20 seconds, a lot can be said in 20 seconds. And then you rinse your hands thoroughly, dry them thoroughly, use a paper towel to open the doorknob, cover your cough.
I think we're just going to get a cot and put it in here. We are in the Wayne County Annex Building in the Commissioners' Council chambers, where we've spent quite a bit of time here recently, having a chance to talk to Wayne County Clerk Debbie Berry. Debbie, how are you?
Good. I'm doing good, thank you.
Thanks for taking some time and talking with us. As things change, as things progress, everybody keeps getting some new information. Obviously, vitally important to us is our ability to vote. We were going to have an election on May 5th. That date got moved by the state late last week. So we asked you to sit down with us to kind of help us catch up on where we are. So can you tell us where we are?
Yeah. Well, for the time being, I can, with this crisis that everyone in the Hoosiers are wading through waters we've never had to wade through before. But we still are going to have an election, thankfully.
That's good.
Our governor worked with our Secretary of State, Connie Lawson, and with both state party chairs of the Democrat and Republican major parties. And so they did come to an agreement to postpone the election to June the 2nd. So that's the first Tuesday in June. So that election will be held on June the 2nd.
Okay.
So that, with that moving out, that moves all the other dates and deadlines out also.
Okay. When you say it moves all the other dates and deadlines, the first deadline that was probably approaching us, being the general public, was the date for us to get registered to vote, which was in April. That date is now moved?
That date is now moved. It was April the 6th, and now it is moved to May the 4th. So the deadline for voters to register, they can register online at indianavoters.com, and we encourage voters to do that online because so many of the public buildings are closed or access to. Now the courthouse to date, as of today, has not closed to the public, but they are screened at the entrance. So some people are turned away, but if you want to register to vote, you certainly can do that online. It's safe, it's secure, indianavoters.com. And that deadline again is May the 4th at 11:59 p.m. So that you have a little bit longer if you do register online. If you do not, then it is at 4:30 when the courthouse closes, if we still have access at that deadline date.
Okay. One of the things I'd like you to kind of go through as we look at these dates going forward, and this is all speculative at this point. We think we hope everything will be cleared and we'll begin to get back to normal at that point in time. But if not, there may be some further shifting of things. But one of the things that a number of people have not done is voted absentee, as they call it. Can you go through the process of what people need to know, and based on these dates as we know them, when they would be able to start and end that process?
Sure. Because Wayne County is a vote center county, when we open for early voting, which those dates also, have been moved, and we'll touch on those, but that process for early voting is actually absentee voting. When voters go in the vote center, they may or may not remember until they get there, but we have you sign a form stating that you understand you're voting absentee. It's just a form that everyone signs, and we keep it on file so that people know it is counted. It is a vote that's counted, but it is not counted until election day. Even though you cast your ballot, those machines are preserved, and on that card, they do not go over the internet. It is preserved on that card, and then those are counted on election day by the Wayne County Election Board.
Most people don't read those cards.
No, well,
you all ask us to sign, and we just kind of go, okay.
Yeah. They're just it's just a form like a 1099, or it just has lines where you're to sign, and the staff highlights them so that we can keep things moving at a good pace if there's a crowd. But all of absentee voting, all of early voting is a form of absentee.
Okay.
The 29 days before the election, when voters actually come to the courthouse and vote in front of the absentee board, that is absentee voting. You can submit an application. You can download that application off of my website if you just go to Wayne County, Indiana. It has to be Indiana because there's lots of Wayne counties. Wayne County, Indiana, Clerk of Courts. Go to my website, and then all of my offices, because I do have 3 offices, the clerks, the small claims, and voters registration. Go to voters registration, and it'll say voting and forms, and you can actually print that off, sign that application and send it to us, and then we will in turn send you the ballot that you requested, because in the primary you have to declare whether you want a Republican or Democrat ballot.
Okay.
So then when the time comes for us to send those out, then you'll get your ballot, and then there's a deadline for it to come back, and that has to come back in a secured envelope. Now we do provide a postage paid envelope for the ballot, but for the application you have to mail that back, and you do have to pay the postage on that and use your own envelope.
So as we move through this cycle, it could be possible, you know, it would be probably a lot more work for you all, but it could be possible that we could, with enough notice, really do mail-in voting.
That's correct. That is correct. The state, you know, they will, as we move forward, we'll see, but they could elect to go to all mail-in ballots.
Okay,
That
and
is
there's
correct.
already a process in place, and
There's legislation, you know, I mean, it's a concern. The thing about postponing the election any later, of course, is a great concern to our state party chairs, because the parties have to hold conventions. So there's a deadline for that those conventions be held. So, you know, I think everyone is anxious to make sure that we do hold an election, because it's a vital, important part of everyone's civic duty to vote, and to, you know, vote in the people that we want to represent us, whether it be local government, state government, or federal government. It's a big election this year. This is our presidential election. So we've taken a lot of steps to add additional poll workers, you know, additional training. We've got some new things going on, you know, within having new election e-poll books that we got to use last year in the fall election. So, you know, we want to make sure that all of our election workers are trained, which, you know, brings up a whole nother path of worry for a county clerk, because the average age for an election worker, for a poll worker, is 72 years old.
wow.
So
Okay.
they are in that category at high risk, you know, so we have to take all kinds of extra steps to make sure that they're protected, and that we, you know, when we do open the vote centers, that they're protected, and that we provide, you know, enough space between voters, that we provide the hand sanitizer, anything that they need, and remind them to be safe and protect themselves. So, you know, with this election and with this pandemic, it's a concern for everyone, even as the election draws closer.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're speaking with Wayne County Clerk Debbie Berry, who is handling some changes that have taken place because of the COVID-19 pandemic that we're under. The date for the election, which was May 5th, has been changed. It is still a Tuesday. It is Tuesday, June 2nd, but it has also shifted dates for you to be able to register to vote. And you said that there were some other things involved with that, so I want to give you a chance to kind of go through those things that the citizens need to know, because the right to vote is incredibly important.
Well, and if you are one of those persons at risk by your age, or if you have a immune system deficiency or something that you need to protect yourself, we encourage you to request an absentee ballot. And now the deadline is moved for that to Thursday, May the 21st. So that's the deadline by 11:59 p.m., you know, to request, to get that application in that we talked a little bit about, being able to access, or calling our office at 973-9226 to request an application for an absentee ballot.
How early can they do? I mean, if people have made up their minds now, can they start filling out that application and sending it to you, or is there a start point for them to be able to request that?
No, we are already requesting, we are already accepting applications for absentee ballots, but the date is moved out now that we will actually be sending them out.
Okay.
So, but we are accepting applications. They are available to download. You can call, again, 973-9226. We will send you an application, you know, to request an absentee mail-in ballot. And then that will bring us up to the 2 Saturdays before the election. The 2 Saturdays before June the 2nd is May the 23rd and May the 30th. So we, always have those 2 Saturdays open at the clerk's office, voters registration, and at the Kuhlman Center. Right now, those still are, of course, approved to be used if we move forward with, people actually going in. If the state doesn't change that again, that'll be those 2 Saturdays. And then early voting at our 4 locations will be, of course, May the 25th through the 29th, but the 25th is Memorial Day, so our election board will have to have a meeting, for that, because of it being a holiday and a very important holiday to all of us, to honor our veterans who gave their all on that day.
So is there a chance that you all will actually start that a little bit, or maybe the Friday before or something, or shorten it, or there's that conversation that you all have to have?
That's that conversation we have to have, Eric.
When will that conversation take place?
Well, it'll happen at our next election board meeting. Of course, it will be brought up. The first Monday of every month is our scheduled election board meeting. We have already sent letters out to poll workers, for their training. That is going to be moved out because there's no sense in training them now, for something that's been moved out. We like to have it as close to that election as possible. So we're making phone calls busily now to make sure that our poll workers know that they should not come in, until they get notified again once the board sets those training dates again. So yeah, it's a lot of work right now to make sure that this election runs smoothly.
We don't want to get too far ahead of the curve here and have you telling us a lot of things, but right now, is there anything else that we need to let people know about? We've told them about a change in dates. Your phone number, 973-9226, is one that they need to remember. You also mentioned your website, and you probably should do that again for us, please.
Sure. If they just, in the search bar, search Wayne County, Indiana, Clerk of Courts. It'll take you to my website. You'll recognize, my picture is there so that everyone knows they've got the right Wayne County. The only thing right now is the extension of registering to vote. You can extend that, and the extension for mail-in ballots, to ask for an application for that.
Okay. Wayne County Clerk Debbie Berry, we will be back in touch with you as things continue to move, and we appreciate you taking the time to talk with us.
Well, I appreciate you taking the time to let the voters know what's going on. Thank you.
It's a personal policing. It's a personal responsibility. It's being in close proximity to others that increases the spread, or touching flat surfaces and then not washing your hands and touching your face. These are the issues. That is really, really hard to police. Is what will keep the spread from happening rapidly, which will spike the healthcare system and make it hard to treat people. You as a citizen have a responsibility to take this very serious because human lives are at stake.
Hi, how can I help you?
My daughter has a fever and she isn't feeling well.
Okay, let's get her feeling better.
Receive quality care within the comfort of your own home. Read Health Now, right beside you.
In Focus on Whitewater Community Television's WGTV Channel 11. Finally, the sun came out, and we're outside the Reed Health Respiratory Clinic, and we're talking with Dr. Bhandari, who is the medical director of the Reed Outpatient Respiratory Clinic. This used to be urgent care
Tell me, doctor, why did this become a respiratory clinic?
So the purpose of moving the urgent care was to start a respiratory clinic in order to centralize all of the respiratory disease within our community. That's given the new COVID virus and the coronavirus crisis that we're facing in our country. The purpose of this clinic is to avoid patients that have respiratory symptoms to be going to many different practices, and also to teach an opportunity for self-isolation if you have respiratory symptoms. So this process is for patients that have symptoms. You may have COPD, you may have influenza, there may be other respiratory illnesses like a viral sinusitis that may be going on, and the purpose is to centralize them so that we are not having community spread with patients that may be having respiratory symptoms. We're trying to keep the staff healthy and those patients that may be in the physical waiting room with others that have respiratory symptoms healthy as well, and to avoid what we call surge into the hospital so that the hospital can focus on those that are severely ill. So this process is by appointment only. You must have symptoms, and again, it is important to understand that this is not a COVID testing site. So like much of what we're seeing in the media of drive-up testing for COVID, this is not the process that's happening here. What we are doing is we're trying to protect and isolate all the respiratory disease in one place and then triage accordingly to the hospital or back home with close remote follow-up if necessary. Patients call Read hotline. There is a hotline available for patients that may have respiratory symptoms. That includes fever, cough, shortness of breath, or worsening of their pre-existing respiratory condition. They are triaged and they are given an appointment time. Once you have an appointment time, your vehicle is the way that you will show up. We ask that you understand that you may be brought out of your vehicle into a building with no visitors allowed in the building, so you must come on your own. You are then brought to a registration area, and then there is a testing tent where initial triage happens. If you're found to be stable with symptoms, then education is given to you and appropriate treatment for that respiratory symptom is given at the testing tent. If you're found to be significantly ill, then you require a more in-depth evaluation. So you are brought to what we call a waiting lot, and that waiting lot is removing the physical waiting room. That is really important in order to avoid infection being passed on to those that may not have that particular infection for which the patient is showing up. You wait in your vehicle, and one by one you are brought in and then evaluated. Once you are brought to the waiting lot, you are then given a ticket where you are waiting, and then staff brings you in one by one to be evaluated. There are then providers there that will evaluate you and triage you accordingly by doing a full, thorough examination. You may be triaged to the hospital and or triaged home with treatment, and then there is follow-up for those patients where someone will contact you within 24 to 48 hours and then continue to monitor you over a series of days until significant improvement, if not resolution, of your symptoms.
What did this building give you that you chose this site as the respiratory clinic?
Excellent question. So we were able to have both lab testing and X-ray available. Remember, this is urgent care, so this is respiratory urgent care. So due to the kind cooperation of our physician and staff of urgent care here, they have moved to 1350 Chester for non-respiratory urgent care and are resuming their hours, and we are using this for respiratory urgent care.
If you send someone home, what is it that you expect them to be able to do?
This is probably the most crucial thing that I need everyone to understand. If you have symptoms or you have suspected exposure, it's important to isolate yourself. What does isolation mean? It means even within your home, the best practice, if you can do that, is find a bedroom, maybe with a bathroom, and pick that as the area where you're going to segregate yourself and isolate yourself from everyone else. Have your meals sent to you and kind of monitor your symptoms so that you are not passing on what potentially could be the virus or other respiratory infection to your family members. Once your symptoms improve and you've passed a certain number of days of surveillance, then I think that is what's practicing good isolation. So it is very, very important if you have mild symptoms that you still self-isolate until resolution of your symptoms.
Real quickly, as we wrap up, tell me, what is social distancing?
Sure. So social distancing, or flattening the curve, we've heard the governor ask everyone to kind of lock down. You know, some of us don't know we have the virus until many days has passed, and we're kind of passing that virus on not knowing. So asking the folks in the community to kind of stay home means that we are not going unnecessarily out into the community. We may or we may not have symptoms, and then someone who has chronic medical conditions that makes it difficult for them to overcome this virus, or are ill, will not catch this. And it may not just be this virus. Remember, we want to remember and keep in mind that if you look at the media, the virus is now in the community. It's not about, do I have the virus or do I not have the virus? We need to start thinking about, am I sick from the virus or am I not? And if I am, I need to stay home if I'm feeling unwell or I think I have exposure. And if I'm really sick, then I need to seek medical attention. And I feel that this is the best gateway through the respiratory clinic for us to do that in a centralized, isolated setting.
As we wrap up, just a reminder, this is not a drive-through facility for testing. For anyone coming here, they need to have an appointment. They need to call ahead or use the Read Now app, question mark?
Correct. So Read Health Now app is free. You can have free screening through that. There's also telehealth. If you have other needs from your primary care, you can utilize that. That's a visit. And then we have a hotline that you can call by phone if you don't have access to a smartphone, and that is difficult. Someone will be able to answer your questions and triage you appropriately via the hotline.
Dr. Bhandari, we greatly appreciate the time today.
Thank you. I wish everyone well, and I appreciate everyone's cooperation in the community to kind of lock down and stay home and stay safe. Let's hope that we can fight this fast and get back to our lives.
All right.
Hi, how can I help you?
My daughter has a fever and she isn't feeling well.
Okay, let's get her feeling better.
Receive quality care within the comfort of your own home. Read Health Now, right beside you.
Thanks to all my guests on this week's In Focus program. We'll be with you again next week with another edition of In Focus. Replays of this program can be seen beginning tonight at 10:30. As always, I wish you well. Take care.